We want to go now to Dr. Tulio de Oliveira. He leads a team of South African scientists that first reported Omicron to the World Health Organization. He joins us now from Stellenbosch, South Africa. Good morning.
Uh, Good morning.
You are seeing the impact of Omicron firsthand. Who is getting sick, and is this mild or severe illness?
The Omicron, it's only a few weeks old. We detect that very quick. We estimate that the date of origin of these variants, it is either end of October or beginning of November. So what it means that only now we are beginning to see the sick patients to arrive in the hospital. Yeah. Why that? It's because normally it take a few weeks between infection and the need for hospitalization. So what we saw in the last few days, it is an increase in admission, and that it is something that we are really looking very carefully at the data in South Africa.
Is it too early to say if the illness is mild?
The responsible way to say is that a little bit early to say that it's mild. Why that? There is two main reasons. The first is that normally waves of infections tend to start with the younger population, which will not develop a disease. And the second is that between vaccination and previous infection, that would be most of the population in South Africa. For example, we estimate between 60 to 80% of the population got previously infected. And even with a vaccine coverage of 40%, it means that you have large pockets of population immunity. So that's what we're gonna have to tease apart. If the mild case is due to young people get infected, or if the previous population immunity from infection and vaccination are responsible for decreasing the number of hospitalized individuals.
Is Omicron affecting small children differently? We're seeing numbers of hospitalized children under the age of 5 in South Africa. What's going on?
So one thing that we know from the Omicron is that tend to generate very high viral loads. What it means that the infection, and because it's a very transmissible variant, tend to have higher level of virus replication. And one thing that we knew from children and from the other variants, that one of the reasons why they didn't develop disease is the lower level of the virus. So what we have seen in the beginning is large number of young children being hospitalized, but these numbers are being decreased as this variant starts spreading in the older population.
So does it affect children differently?
It is because it's a very highly transmissible variant. It tends to cause a high number of infection in children. At the moment, it's difficult to tease if the rate of hospitalization of children on the beginning is due to the sheer number of infections in the younger population, or if it is because cause more severe disease. But one thing that we see is that the younger population presenting to the hospital is decreasing over time, especially in the last few days.
You have said that the Omicron variant probably incubated or mutated inside the body of a person with a suppressed immune system, possibly someone with HIV. Are you seeing a higher rate of infection among those who are HIV positive?
Okay, so let's be very clear. What we know from variants, we learned that on the alpha, potentially on the beta, and the Omicron, that they have sign of being evolved in immune suppressed individuals. Because the Omicron emerged in Johannesburg, which is to South Africa, is what Atlanta is to the United States of America, our biggest international airport, the biggest one in the continent. It means that this variant could have come from anywhere else and was amplified in Johannesburg. So at the moment, our suspicious, and not only our one, but the top evolutionary biologists in the world, is that these have sign of of being developed in immune suppressed individuals, such as cancer patients or patients that get, for example, transplant or HIV immune suppressed individuals. Yeah. In relationship to the HIV population, we know two things. Yeah, that HIV first is not the problem, because if you are HIV positive and you are viral suppressed, the viral suppressed individuals on antiretroviral therapy, it will respond as an uninfected person. What it means, it will clear the virus, the SARS-CoV-2, and they are less likely to develop disease. But what we know from people that are HIV and not on antiretroviral therapy successfully is that they're going to stay longer infected and they're going to have a worse clinical outcome. And that's not only specific to HIV, but any kind of immune suppressive disease such as cancer.
Do you believe that you are past the peak of infection in South Africa? Because recent trends are suggesting there's a slowing.
We do not know, and one should always be very careful to look at individual daily tests. What one have to do is to look at the general trend over 7 or 14 days. What we know is that the last week we were in the highest number of infections from Omicron. Yeah, and what we're going to be doing is looking very carefully at the data. Potentially, Gauteng and Johannesburg may have peak, but what we have seen is that this has spread for the other 8 provinces. South Africa has 9 provinces, which is like similar states in America. And in all the other 8 provinces, the numbers are increasing and are increasing very fast.
At least 24 countries have travel restrictions on South Africa. Dr. Fauci here in the US said America would like to lift it as soon as they have evidence to justify it. Do you believe the travel ban can be safely lifted now?
Yes, of course. First, travel bans, they do not work. And you're going to remember one of your previous president that was the first one to put a travel ban to China, and the United States of America end up with the highest number of infected individuals of SARS-CoV-2 and with the highest death toll in the world. And not only travel bans do not work, but they also will discourage scientists like us that have been brave enough to identify a variant that have emerged like a week or 2 after that emerged, but it will all give the chance that countries and scientists, when they identify variants, they decide not to come public, which would be the worst thing for the global pandemic. I personally have talked to Tony Fauci many times in the last few weeks, and we both agree that not only the travel bans should be released because not effective, but will discourage the rest of the world to become public in key crucial data that can help the response to the pandemic.
All right. Doctor, good luck with your research. Thank you for your time today. We'll be right back.